Hello and welcome to Combat COVID-19 Community Support. I'm Dawn Creech. I'm so glad that you've joined us this afternoon for a really fun Friday live event with Dr. Ann McQueen. She's going to be talking all about humor, the science behind how it helps your physical health and your mental health, and how you can use humor to help you get through the COVID crisis. So just a little bit about us. We are an informal coalition of healthcare providers and other community leaders that are working together on a series of live stream events so that you can take care of yourself and your family's health during the pandemic. And we are funded by the Central Oregon Health Council. Now, really quickly, before we dive in, I do need to let you know that this event is provided for educational purposes only. It is not offered as medical advice or medical opinions. If you do have a mental health or medical concern, please contact your healthcare provider. Now we're joining you live from Facebook and YouTube, and we have lots of opportunities for audience interaction today. So please type into your screen comments, questions, and you're actually going to have a chance to vote on a lot of different funny things that Dr. McQueen has planned for you. And with that, I am going to turn it over to Dr. McQueen.
Hello, everyone. I'm Ann McQueen, and I am the Research and Policy Integration Manager for the Aging and People with Disabilities program within the Oregon Department of Human Services. But I'm not going to talk to you from an aging perspective today. I'm going to talk with you from a humor perspective today. And I'll start with a little disclaimer and an apology. I have a small dachshund who barks at almost anything and is almost blind. So if she decides that she's going to bark, you may hear it. So I'll apologize in advance for that. I want to thank Dawn and Matt ahead of time for the technical support that I'm sure I will need throughout this presentation. But I'm so glad that you all joined. And I'm hoping that the next 45 minutes or so that we spend together gives you just a little bit of a boost when it comes to isolation and all the things that we're going through right now. I'll start by showing you a picture of one of the people who inspires me. This is my daughter, who is now 12, so she doesn't look like this anymore, but she makes me laugh every day and has really shown me the importance of humor. One of the reasons that I began to study humor was working in long-term care and working with people who had Alzheimer's disease and other forms of dementia. And I found that humor was such an effective way of helping people feel more comfortable with the situation of being in long-term care and receiving care. And I think that's true of everybody. Humor is a bonding mechanism. It does all kinds of great things for social interactions. And so I'm hoping to share some of that research with you today, and hopefully along the way that we'll all have a few laughs. Unfortunately, since I can't hear all of you, I won't be able to hear you laugh or see you smile, but I'm going to imagine it in my mind because laughter is contagious and it makes us all feel good. And we'll talk a little bit about why. So here's just a basic overview of what our session content will look like. We'll talk a little bit about what humor is, how it works. We'll talk about research on humor and laughter. We'll talk a little bit about the physical effects, the emotional effects, and the role that humor plays in the social bonding and social interactions. Then we'll spend a little bit of time talking about how humor can be useful in crisis mode. And then we'll talk about a few things that you can do as soon as you leave this presentation that can help you survive COVID-19 with a little bit more humor. I want to also let you know that this is not humor is not a silver bullet. But it can brighten your day a little bit. It can make a day that was on a scale of 1 to 10, a 2, maybe into a 4 or a 5 on a good day. So I encourage you to be yourselves and use the kind of humor that you think is funny, and enjoy the kind of humor that you think is funny. Everybody's sense of humor is unique, and we'll talk a little bit about that too. So before we get started, I need to give you a COVID-19 safety warning. And Matt's got that pulled up. So as soon as it's ready to go, I'm going to have him play this for you.
Yeah, I really don't understand why everybody isn't following the same rules right now. They're very clear. So let's take a minute and let's go over them again. First, you must not leave the house for any reason. unless of course you have a reason, and then you may leave the house. All stores are closed except those that are open, and all stores must close unless of course they need to stay open. This virus is deadly, but don't be afraid of it. It can only kill people who are vulnerable and also those who are not vulnerable. We should stay locked down until the virus stops infecting people. And it will only stop infecting people if enough of us get infected that we build immunity. So it is very important that we get infected and also do not get infected. You should not go to the doctor's office or the hospital unless you have to go there. Unless, of course, you are too sick to go there. This virus has no effect on children except for those children in which it affects. The virus remains active on different surfaces for 2 hours or 4 hours or 6 hours, but in most cases it's days and not hours, and it needs a damp environment or a cold environment that is warm and dry in the air. Unless the air is plastic. Schools are closed, so you need to homeschool your children unless you can send them to school because you are not home. If you are at home, you can school your children using various portals and online classrooms unless you have poor internet, more than one child, only one computer, or you are working from home. Baking cakes can be considered math, science, or art. If you are home educating, you can include household chores within their education curriculum. And if you are home educating, you may start drinking at approximately 10 a.m. every day. If you are not home educating children, you may also start drinking at approximately 10 a.m. Masks are useless at protecting you against the virus, but you still need to wear one because it can save lives. And in some cases, it may even be mandatory, but also maybe not. You must not go to work, but you can get another job, at which point you may go to work. Stay home. I don't know how many more celebrities we need to have tell you how important it is to go outside and take care of your mental health. There is no shortage of groceries in the supermarket. There are simply many things missing. You don't need to go buy a bunch of toilet paper, but you should buy some in case you need it. If you are sick, you may go out once you are better, but those in your household, they cannot go out once you are better unless, of course, they need to go out. Animals are not affected by the virus, except for that cat that tested positive in Belgium in February, plus a couple tigers. The number of corona-related deaths will be announced daily, but we don't know how many people are infected because we were only testing those who are almost dead to determine if that's what they will die of. The people who die of corona who are not counted won't or will be counted, but maybe not. To help protect yourself during these times, you should be eating well and exercising, but exercising only eating what you have at home to avoid going to the stores unless you need toilet paper or a fence panel. It's important to get fresh air, but don't go to parks, but do go walk in other places. Just don't sit down unless you are old or pregnant. But if you do sit down, don't sit for too long. Unless you are old and you are pregnant, in which case you need to sit down. But if you do sit down, don't eat unless you've had a long walk, which you are allowed to do if you are old or pregnant, except for times in which you aren't. Don't visit old people, but you have a moral obligation to take care of old people and bring them food and medicine. And finally, no businesses will go down due to coronavirus except those businesses that go down due to COVID-19. I hope this cleared up any questions about what we should and should not be doing during this time. Please educate your friends and family with this information so we can remove any and all confusion surrounding this time. Thank you.
So I hope you all enjoyed that little ditty about COVID-19. And other than that, I want to ask you now, when was the last time you had a good laugh? A good hearty belly laugh, not counting the thing you just watched. So try and think about that. When was the last time? And we're going to practice using your chat feature here. So if you type into your chat feature a number that indicates when the last time you had a good laugh was. So type in a number 1 if you feel like it was within the last 24 hours. Type in a number 2 if you feel like it was 2 or 3 days ago. Type in a number 3 if you feel like it was 4 or 5 days ago. And type in a 4 if you feel like it was more than 5 days ago that you had a good laugh. So as you do that, yes, your name will show, but I will only use first names if I'm going to ask a question. And Dawn has able to see what's going on and see if people have shared. Dawn, do we have any participants who have used their chat feature?
We do have some votes coming in, so let's give folks maybe another 30 seconds to get their votes in.
Sure. So again, I'll just mention to you in case it's helpful, you want to type in a number 1 if you feel like your good hearty laugh was in the last 24 hours, a number 2 if you feel like it was 2 or 3 days ago, a number 3 if you feel like it was 4 or 5 days ago, and a number 4 if it was more than 5 days ago. This is just going to give us an idea of how much humor you've got in your life right now. And for some people, it's okay to have it just 2 or 3 days ago. Some people want to have hearty laughs multiple times a day. So what have we got, Dawn?
Yeah, so it looks like on Facebook we have 3 votes for number 1 within the last 24 hours. We've got a vote for number 3, which was 4 or 5 days ago. And then it looks like on YouTube, we have a vote for number 4, which was more than 5 days ago. So I'm not sure if like Facebook is funnier than YouTube or what, but hopefully we're bringing some parity to that today.
The people who are on Facebook are receiving more laughs. Maybe it's because they're looking at a lot of things that are funny on Facebook. So I think an important thing to mention about this is that it's different for everybody. Some people can go a week without having a hearty belly laugh and be just fine. Some people don't tend to laugh as much at humor. They tend to smile or chuckle or shoulder shake. So humor is very different for different people. One of the things I want you to do is think about that time when you had that laugh, or you can think about a time when you just saw something that was funny. And I want you to think about where you were, who you were with, what you were doing, what happened that you thought was funny, and what mood you were in before the funny thing happened. And the reason that I want to have you think about these things is because all of these things have an impact on how you receive a humorous stimuli. If you're with people you feel comfortable with, people you love, people who are friends, you're all laughing together and something happens, you're more likely to laugh. If you're in a place where you feel comfortable, where you feel like it's your territory, you're more likely to laugh and be able to enjoy and receive humor. If you think about the thing that you were doing, being, say, with your family playing a fun game, you're going to have probably a different reaction to something that's humorous than you would if you were in the middle of doing something on a Zoom meeting at work. And then the thing about what happened when you thought was funny. What was it that was the funny stimuli? Is it something that you normally would find funny, or is it something that caught you off guard? That makes a difference. And then what mood you were in before the funny thing happened. A lot of times, if you're stressed out and you're tense, which a lot of us are during this period of time, while we're isolated, and we're hearing things on the news that are not pleasant, it's a little bit harder to muster up what you need to have a hearty laugh or to appreciate humor. So those are just some interesting things to consider. I love this quote, and I'll read it to you, and then talk a little bit about why I included it. It's in the what is humor category. And I think we talked a little bit about defining humor. I really lied to you when I said that I was going to define humor, because it's almost impossible. And this quote explains, getting a firm grasp on all the elements of humor is similar to controlling the use of liquor. It's like trying to tie a hair ribbon on a bolt of lightning. It's elusive. Humor is one of those things that we all have a shared understanding of, but it's so different for each one of us. It's so subjective. So I love this quote because it kind of captures that. So let's talk a little bit about the elements of humor. So you have some kind of humorous stimuli, as shown in the orange box, and then you have your brain kind of unscrambling it. And then you have an emotional response to that unscrambling and a physical response to that unscrambling. So, in other words, if you look at this in a slightly different way, you have a humorous stimuli, which could be a joke, a comment, a cartoon, a story, a situation, something like that's in the red box. And then your brain interprets that and unscrambles it and figures out, oh, this is funny. And then you have a physical response, which could be a smile, a laugh, a snicker, a giggle. My daughter snorts when she laughs. And then an emotional response, which could be feelings of mirth, joy, happiness, positive mood, hopefulness. And I want to explain all of these things to you because I think that in general, people think of all of these things as humor, but they're all sort of separate pieces within a humorous response. And as you enjoy humor, you might think about those things. You might think something is hilarious, but you may not laugh at it. You might think that something is not funny at all, but you might smile at it because you're a little bit nervous and you don't want the person who's said the thing that they thought was funny to feel embarrassed. So it's interesting to sort of unbraid these things and think about how they work together. So now we're going to have you use your chat feature again. I'm going to show you a humorous stimulus, and I want you to rate it between 1 and 5. So throughout the presentation, I'm going to show you, I think, 6 different humorous stimuli, and I want you to rate those using this scale on your chat feature. And then I may ask some of you who have used the chat feature to explain why you scored some of the stimuli the way you did. So I'm going to let you look at this scale for just a moment, and then I'm going to go to the first humorous stimuli. So 1 is, this is not funny at all. 2 is, it's not very funny, maybe a little. 3 is, I'm neutral about this. I don't think it is or isn't funny. 4 is, yeah, that's somewhat funny. And 5 is very funny / hilarious. So here is the first stimuli. I want you to use your chat feature. So at the top it says, dropped some food off to my grandma and she had a message for me. She's holding up her bottle of wine and she has a note in the window that says, need more wine. Somehow I think I take something away from it by reading it to you. So in your chat feature now, go ahead and rate that from 1 to 5. Again, 1 being not funny at all, 2 being not very funny, 3 being neutral, 4 being somewhat funny, and 5 being very funny. So we'll give you a little bit of time.
Yeah, so Dr. McQueen, we do have some votes coming in. We have a little bit of lag between the airtime and your speaking, so we'll just give a little bit longer for folks to get votes in. Looks like on Facebook we have a 5, so very funny, a 2, not so funny, or not, and then somebody actually asked, can they vote a 6? We've got a 3 coming in, a 1 coming in, and I'm going to check YouTube really quickly. Our viewers on YouTube, it looks like we've got a solid 4s coming in on YouTube.
That's so interesting, the difference between the Facebook folks and the YouTube folks. So those of you on Facebook, I think I heard a 1 on Facebook, and I heard someone who wanted to vote a 6 on Facebook. If the two of you would use your chat feature and just in a few words explain, why did you give this a 1? What was it about it that you thought was not funny at all? Was there something about it that really struck you wrong? And for the person who gave it a 6, what was it about it that made you think it was really funny? And I'll ask you to do this. We don't even have to use your names. We'll just say the person who gave a 1 and the person who wanted to give a 6, because I think it exemplifies something that I'd like to talk a little bit about in terms of humor. So again, if you were on Facebook and you rated this a 1, if you could use your chat feature and just say why you gave it a 1, and the person who wanted to give it a 6, who ended up, I think, giving it a 5, if you could say why you thought it was so funny. And of course, any of you on YouTube who gave it a 4, if you would like to chime in with why you thought it was funny, that would be great too.
Okay, Dr. McQueen, we do have some folks on Facebook that are playing along, which I love. So we have Shiloh, who they rated it on the lower end, and their explanation was they feel sorry for grandma. She must be sad and lonely. So they put a 2.
Okay.
We have someone else, Matt, who responded and said, my 5 is based on the fact that I love the grandma type who can't get out and wants to get more wine. So just thinking that was funny in general. I'll check our YouTube viewers really quickly. And we do have a comment from one of our viewers, Melissa, who says, I can relate.
Okay.
And she had rated it a 4.
Okay, so let's start with the person who rated it as a 1. I think that right now, especially, we're seeing a lot of stories about all of the older adults who are living in nursing homes and assisted living communities, residential care, all of the different congregate living facilities who are really suffering through this a lot more as a population, as an age-based population than a lot of people are, because they live in congregate settings. It's easy for the disease to spread. It's difficult for providers to stop it once it's started. And so there is this narrative now, which there's some truth, in some cases, a lot of truth to, about older people who are lonely, who are suffering through this illness, who can't be with family members because they may be able to pass the virus on. So I think that, the one that was given there really, I think, identifies with that narrative. Then you have someone who gave it a 5, maybe wanted to give it a 6, who said, they love that type of person who, is, an older person who's enjoying life, who wants more wine, who's living it up, who, at least in this picture, seems to be enjoying herself in this moment. So the experiences that you've had in your life and the way that you feel about things really impacts the way that you perceive humor. Or something that's potentially humorous. And there's no right answer or wrong answer. I could interpret this in either way. So I think that's just an important thing to get across. So we'll do a little bit more of this as we come across some of these humorous stimuli. So there was the rating. I should have changed my slide a little earlier. I'll do that next time. So let's talk a little bit now about humor and physical health. I want to warn you again that, humor is not going to make you into one of these young people who's madly in love and being able to kiss while they have their masks on. But humor does have some benefits. And one of the main benefits that's been studied is that outward physical response of laughter. So I'm differentiating here between what humor is, and, or a humorous stimuli, and what might happen in your brain or emotionally versus what happens physically when you laugh. So this is a little bit about the physiology of laughter. When you laugh, you have multiple muscle groups that work together, your diaphragm muscles, things like that, lots of muscles that work together and actually produce the effects of light exercise when you laugh heartily. There are cardiovascular benefits because when you use muscles, your heart has to beat a little faster and pump blood through your body to get to those muscles. So as I said before, it's almost like a light exercise session a little bit, especially for people who are frail, who may not be in peak physical condition. Laughter can be a little bit of a nice exercise benefit to them. There are studies out there also that laughter and humor can benefit your immune system. There's one study in particular where they showed people a video that was kind of sad. They showed people a neutral video and they showed people a humorous video. And within a half hour afterwards, the people who had seen the humorous video had increased levels of immunoglobulin in their saliva, which indicates some immune benefits. There have been studies out there that have indicated that humor is helpful when it comes to pain tolerance. They're not sure if that's because the laughter itself or the effect of humor actually relieves pain or if it's just more of a distraction. But either way, we'll take it, right? There are metabolic benefits. There was a group that got together in 2005 of scientists, and one of the studies they looked at were people who had at least 15 minutes of hearty belly laughter a day burned the equivalent of 4 pounds in a year. And for those of us who like cake, that was a really nice thing to hear. Also, in that original video, she said that baking cake counts as science and math and all of those kinds of things. So just make sure you laugh a lot while you're baking the cake, and it will neutralize it. There are a few cases in which hearty laughter is not recommended. And probably these are cases that you're not going to encounter right now. But if someone's in the hospital and they've recently had abdominal surgery, you don't want to go in there and make them laugh heartily, because that can be a situation that won't be so positive. So here is another opportunity for you to use your chat feature. We're going to show you a video, and then we'll have you rate this video from 1 to 5. We're ready whenever you are, Matt.
Ja, met mij. Vertel. Ja. Ja.
Okay, so now I'd like you to use your chat feature and use that same scale that we had before. Rate that video that you just saw as 1, not funny at all, 2, not very funny, 3, neutral, 4, somewhat funny, or 5, very funny. And we'll give you a little time since there's a lag. So if you can rate that 1 through 5. And then as soon as Dawn is seeing some votes, she'll let us know excuse me, what she's seeing.
Okay, we have some votes starting to come in on Facebook. It looks like we have a 1 and a 3 coming in. And we also had a request for that opening video that we showed at the beginning, which is just hilarious. So I sent out the link for that so people can access it later for more hearty laughs.
Excellent.
On YouTube, it looks like we've got a vote for a 5, a 4, and another 5.
Okay, so now what I'd like to ask you is, if you voted, I think there was one person who saw this as a 1 and one person who voted 5. If you would use your chat feature to explain why you thought this was either not funny at all or very funny, that would be great. We'll give you just a moment to type that in, and when Dawn comes back, she'll let us know.
Okay, so we're waiting for those to come in. I'm sure they're typing them out right now. But we do have a comment from the person who voted 5, Melissa. She said, when she very first voted 5, she said, I wonder if I sound like that. And then she also replied, I love to laugh in public, ... Yikes. So that came in from Melissa. And let's see. On Facebook, the person who voted 1, Nita, said she was not actually laughing.
Okay, so I think when Nita said she was not actually laughing, she was talking about the person in the video. I'm assuming that. Now, Nita, if I'm wrong, just let us know through the chat feature. But I think when I've done this before and shown this video, I've had people who have said, it's not funny when you break someone's phone. It's not funny when you do something that is aggressive in a public situation. And that woman didn't know that she was being supposedly obnoxious. So that wasn't funny. I've had people do that to me. And then also people who, like Melissa, interpreted it as very funny because she saw the person in the video laughing and having a good time, and thought that it was funny that someone thought that was obnoxious and then reacted to it. So again, it's an example of how your life experiences really impact the way that you interpret humor. So let's move on a little bit now and talk about humor and mental health. Dawn, I'm sorry, I didn't mean to cut you off. Was anyone saying anything about the last one again that you wanted to get?
Yeah, we had a couple more comments come in on Facebook. Carol said she voted 5 because it made her laugh. In that tense situation, I would have laughed if that woman was laughing next to me. But one of our other viewers, Amanda, said her laugh makes me laugh, but there is a time and a place for conversations like that. So there's lots of commenting going on Facebook and YouTube, so please keep it coming.
That's great. And I think that harkens back to what we talked about before. If those people had all been out to dinner together and we weren't in the midst of a pandemic and isolating from each other, those laughs might have resulted in everybody laughing together. You've probably all been in situations where you see somebody laughing and you're not even exactly sure why they're laughing, but you start laughing with them because there's this contagious effect of laughing and of laughter. And many of you have probably heard of laughter yoga, where people just get together. There's not anything funny other than the fact that they are directed to ha, 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 ha. And then after a while, they just all start laughing. And other people's laughter becomes the stimulus for more laughter. It's a really interesting phenomenon. So I really appreciate those comments, and I appreciate all of you who are using your chat feature. I think it makes it so much more interesting than just me as a talking head. So, so let's talk a little bit about humor and mental health. Sense of humor is associated with more positive self-concept and self-esteem, lower levels of perceived stress, reduced depressive symptomatology, and positive mood and temporary hopefulness. So there are studies, excuse me, that indicate all of these kinds of things. So part of the challenge with these studies is, in order to be able to correlate or associate humor with all of these things, researchers have had to try to find a way to measure sense of humor. And they've done that in a variety of ways. But there's not really one particular measure that captures a person's sense of humor completely. So there are scales out there that measure how a person uses humor to cope, how a person uses different styles of humor, how humor is related to certain personality traits. So that's how they go about measuring this. But people who do use humor and use mainly positive forms of humor, and we'll talk a little bit about positive and negative a little bit later on, have all of these benefits. Now, one of the ways that humor works is to help people cope with stressors. So how a person copes with a stressor is related to how that person will appraise or interpret that stressor and then deal with it or cope with it. So if you look at the slide that's there, you have a stressor, and then in the middle of it, you have an appraisal, which is, how do I feel about this? And then you have your method of coping. So we'll take a sort of common feeling that's, I think, happening to a lot of people during isolation during COVID, this feeling of uncertainty, which is very stressful. Human beings like to know what's coming next. Now, if you appraise that, or interpret that as being, oh, this is temporary. At some point, we're going to, I'm going to see the people I love again. We will get through this. There will be a vaccine. Things are going to be okay. The way that you cope with that stressor is probably going to be different than if you see that stressor and you think, oh my God, I'm stuck in the house. I don't know when I'm going to get out. I can't see my children, my loved ones, my friends. For me, my 50th birthday is coming up. I didn't plan to spend that in isolation. So I'm a little bit stressed about that. And so the way that I cope with that is going to be very different than the person who sees it all as temporary and knows it's all going to be okay. Now, I put the picture of the cat with the mask on the slide because that's the indication of humor. If you can use humor as a means of appraising or judging or interpreting a situation, that can help you cope with it better. So for me, I think about my 50th birthday and I think, okay, I'm going to send a message to my friends and I'm going to ask them to send me some funny videos of themselves on my 50th birthday so that I can enjoy being with my friends, even though I may not be able to be with them. I probably won't be able to be with them. So that's just a little bit of how humor can work. Now, here is the next humorous stimuli that I would like you to rate. It's a cartoon, and I'll give you a few moments to read it and then rate it from 1 to 5, just like we did before. If while you're rating it, and you rate it as a 1 or a 5, and you would like to just go ahead and say why, you could type that in now, and we could save a little bit of time. And here's the rating scale. Thank you, Matt reminded me.
And our viewers on Facebook and YouTube are just now seeing that. So we're going to give them a moment to read it and respond with their vote.
Perfect. And as I said before, if you'd like to put your vote in and also add a few words about why you voted the way you did, that would be great. And Dawn can share some of those with us once they come in.
Okay, on YouTube, it looks like we've got a 4 and a 3 coming in, and also someone saying, wow, 50, you look 20, which that's
the best comment ever.
very nice comment. And then it looks like we've got some votes coming in on Facebook as well. We've got Carol voted a 4, Tyler a 2, Matt a 3, and Amanda a 5. So we have a lot of variation on this one.
Tyler, would you mind talking about why you gave it a 2? And whoever said that I looked 20, I have a $10 bill for you that I can arrange to get your way.
Great. Also, we did have someone who just came in with a vote of number 1, and they said, having been a mother-in-law, I do not find this funny at all.
Okay.
We'll see what's coming in for other chats on YouTube.
That's great. I'll address the comment of, having been a mother-in-law. I think mother-in-laws often get a bad rap, even when they're wonderful, just because there's this whole mother-in-law thing, using my air quotes. So, it's another example of how life experiences can really color the way that you see the world and the way that you see humor. And that's very valid.
And we also have a comment from Carol on Facebook who says, I know a lot of COVID humor is exaggerated because although I don't feel like murdering my husband, I do want to slap him with a spatula some days.
Yes, exactly. Well, and I think even in the best relationships, you don't, you get frustrated with people. So that makes a lot of sense. So I think I want to keep moving because I know that we're short on time. So I want to talk a little bit about humor in crisis, but keep those comments coming as they come in. Dawn will see them and she can interrupt me anytime. Um, So there's some research out there about humor and how people deal with it in crisis situations. And some of that research has shown that people um, can change their perspective a little bit about what we talked about in terms of coping. Um, and they can begin to heal emotionally because they found something funny in a situation that previously had been seen as only tragic. Humor can help people step outside of a situation that's really overwhelming to them and to start to make meaning of circumstances in a different way. We've talked a little bit about laughter being very contagious and sharing laughter with people as one way to bring joy into difficult situations. I think some of the news that you've seen at times has probably, when you've seen healthcare workers and other restaurant workers and people who are really struggling right now, the heroes that we're talking about, sharing laughter and sharing humor to try to get through this. Um, and then there are others who can't do that, who react differently to this same crisis. So I think it's just it's interesting to note those things. I want to talk just a little bit about the idea of dark humor, black humor, gallows humor. They're all kind of referring to the same thing. And this is a type of humor that makes light of subject matter that's really considered taboo, things that are too painful or too serious to discuss. So sometimes you'll hear people make a joke and no one laughs and they say, "Oh, too soon?" That is kind of gallows humor. It's laughing in the face of terror or danger as a means of trying to find power over suffering. And it really calls for a decision by people who appreciate it to not be victimized by terrible circumstances. And in a situation like this, I think the key is you really have to know the people that you are using this dark humor with and make sure that it's going to be okay with them, that it's not going to be painful for them. So it really is something that you want to use with caution. I think there are certain television shows that capitalize on dark humor, and you know which ones those are. And then there are others that the humor is very light and not at all. I guess the word would be couldn't be interpreted, too much as being offensive or terrible. So I just wanted to put this in there because I think the situation we're in now with COVID-19, there are people who are enjoying gallows humor, and that's helping them get through. And there are other people who, if you tried to use this kind of humor, it would be offensive to them. So here is another opportunity for you to view a video and rate it. So I'll let Matt get that queued up.
Das hier ist mein Sektor. Das hier ist das wichtigste Gerät des Küstenwächters. Das Gerät und das Gerät. Überlebensradar.
Mayday, mayday. Hello, can you hear us? Can you hear us? Can you... Over. We are sinking. We are sinking.
Hello? This is the German Coast Guard.
We are sinking. We're sinking.
What are you thinking about?
So once again, I've got a slide up with the rating scale. If you would take a moment using your chat feature to rate that video and mention why you thought it was either not funny or very funny, that would be great. This is the last one that I'll have you rate because I want to honor your time and make sure that we get through all of our content.
Yeah, so Dr. McQueen, it looks like on Facebook, we've got a vote for a 5, just saying, I love dark humor. And it looks like on YouTube, We've got a few 5s coming in, one saying it was incredible, another saying it made me laugh. So far, that's what's come in. We're on a little bit of a delay. We did just get a vote on Facebook for a 3. So just kind of feeling neutral about it.
Great. Well, some people, when I've used this in the past, I've had some people give it a 1 because they thought that it was culturally offensive. They thought that it was making fun of people who didn't speak English or who didn't have English as their first language, which again, it's very valid. I've also had people react the way that many of you are right now, saying that it's very funny. It's just this case of mistaken identity of a word. So we'll go ahead and move on, and I want to talk a little bit about social interactions. This is really an important slide, that social relationships, or the relative lack thereof, constitute a major risk factor for health, such as cigarette smoking, blood pressure, blood lipids, obesity, and physical activity. So having social relationships that are positive in your life are just as important as not smoking, having good blood pressure, getting physical activity, all of those kinds of things. And humor is a part of social interactions and a part of relationships. It helps people enjoy experiences together. It relieves tension. It brings people together in a lot of different ways. So I want to talk a little bit about positive humor and what it does in conversation. It promotes bonding. So when someone tells you a joke, or shares something humorous with you, at least I find, and research has found, that you feel special. You feel like you're part of an inner circle because someone has shared that with you. It signals that you're included. It helps build trust. There was an interesting study that was done among people who were college age and potentially they were single, and they wanted to date people who had a good sense of humor. If they were able to laugh together, they wanted to talk together more. They wanted to spend more time together. Positive humor encourages hopefulness. It's also a means of face saving. So what I mean by that is you could make a mistake, but then if you can make a joke about it, you've saved face. You've saved your reputation in a way. And like we talked about, stimulating further interaction. Now I want to talk a little bit about negative humor. You've probably all been in situations where you felt like someone was making a joke, but there was really serious criticism or anger behind that. So humor in a negative way can control others' behavior. It can be a socially acceptable way to criticize or demean a person without actually coming out and doing it. Many of you may be familiar with someone who will say something that's really out and out kind of mean, but then when you take it that way, they say, "Oh, I was just joking." And that supposedly just makes it all okay. But it doesn't really, because the person who's been criticized still feels bad, and then has no recourse to say, "No, that hurt my feelings." It enforces unbalanced power structures. There was an interesting piece of research about how people with dementia could use humor to get on the same level as their doctors, to feel like they were had as much control over the situation as their doctors did when they used humor. Which was a positive way of using humor. But if you use it to undermine somebody, it puts them in a lower power structure. It can also isolate people as outsiders. Humor is a bonding mechanism. We've talked a little bit about that. That jokes are funny because they're based on a sense of common background, common experiences. And for those of you who saw things that you didn't think were funny, there wasn't that common experience there. So it's really important to think about the bonding or the potential not bonding that can happen with humor. This is another stimuli that you can rate if you'd like to, but I think we'll skip having you having you rate this one in person and just let you see the cartoon. Actually, I do have one more that I will show you. So I want to make sure that we talk a little bit about getting through the tough times. These are things that you can do to try to add a little bit of humor into your life, to try to see what's silly and ridiculous, to try to be spontaneous, and encourage that in others. Don't be afraid to laugh at yourself. That's really one of the most healthy things you can do. If you hear something that's funny or find a story you find funny, share it with others. Start that conversation, start that bonding. Try to find ways to add humor to your everyday interactions. Try to be playful and encourage others to do so. Laugh with people rather than at them. There are times when I really like a person and they say something meaning to be funny, and I don't necessarily find it hilarious, but I laugh anyway because I really like that person. And the laughter is more of a, of an encouragement to them than necessarily that the stimulus was funny. And I think that's important because it's really about the relationship as much as it is about the humor. So I think we've had a little bit of a cake theme with today. We've heard about cake several times, and so that's why I put this picture up there that has a toilet paper roll cake. So here are the things that you can do, and we won't use the chat feature, but you can share books, podcasts, television shows, movies, people to follow on Instagram or other resources with the group. If you'd like to use your chat feature at any point and post those on Facebook, that would be great. And that way, at least the people who are in this talk together can all access them. And then this is the last thing that I'd like to show you. And again, we don't have to rate it, but I do want to make sure that you see it because I think it's pretty apropos for the time that we're in.
Hello, Internet. It's Pluto here, and I'm getting the feeling that there's a time of crisis for the two-leggeds, and so I thought maybe I could share some perspectives from the four-leggeds, and maybe that could help you. So we like to just chill out at home, and we curl up, and we wander around and play with the tennis ball, and there's lots that you can do. And I heard that there's a crisis with the toilet paper, which I don't understand. I mean, for cats, I understand because they like to play with it, but cats aren't that important. But for humans, well, what my mom, what she does for me is she cuts the hair on my bum really, really, really short, and then so stuff just comes straight out, and then there's no worry, it's all good. And then also, my other mom said that she went this morning and there was nothing in the grocery store, so she said there won't be any snacks today. But for me, it's really easy for snacks. You just go sniffing around a little bit, and if you live near like a little school or something, even if it's closed, there's going to be some leftover snacks around there for sure. And also at the end of the street, at the curb area where the water goes down, sometimes snacks get stuck around there. So it's a good place to check for a little snack if you're really hungry. So it's really very important that you all be good to each other. And the practice the social distancing, so you shouldn't sniff other people's legs, and you really shouldn't sniff their crotches until this whole thing is over. That's social responsibility. So I'm here if you need me, and I'm really wishing you some good luck, okay? All right, bye.
I hope you guys enjoyed that. I won't have you rate it. But I did want to share just a couple of closing thoughts with you, a couple of closing quotes. Your attitude is like a box of crayons that color your world. Constantly color your picture gray, and your picture will always be bleak. Try adding some bright colors to the picture by including humor, and your picture begins to lighten up. And I realize that humor isn't for everyone, only for people who want to have fun, enjoy life, and feel alive. So with that, I want to turn it over to Dawn and find out if there are any questions or comments.
Yes, Dr. McQueen, thank you so much. I know here we were laughing very hard at that last video, and we've gotten a couple other audience members that have given us laughy emojis and saying, "This is adorable. My 10-year-old and I are laughing," with lots of exclamation marks. So it looks like the audience really enjoyed that.
Good.
And we did get a question from an audience member a little while back, but I thought it was an interesting question. I'm wondering if you could address, how does nervous laughter fit into all this, and what is it, and what causes it?
Well, nervous laughter is an interesting phenomenon. I think that what happens if you go back to some of the slides that we talked about where your brain is unscrambling things, and it may be, I think what happens during nervous laughter, and I've read a little bit about this, is that your brain is trying to unscramble something, but it doesn't quite understand what it is that's being unscrambled. It's not getting that same kind of benefit that happens when your brain realizes, oh, this is how something's funny, or this is how something's ridiculous. And so the nervous laughter then becomes sort of a reaction, not to humor, but to, I don't know what to do. And there's this kind of, and I think generally people know that it's safe to laugh at something, or that is a reaction that they can give that isn't going to offend someone. When you think about the alternatives, of just standing there and, sitting there and staring at someone, or it just sort of releases some tension, and laughter is a tension release. There's tension that comes when your brain is trying to unscramble humor, and there's that release. There's also tension in stressful situations. So I think that's probably the best way to answer that. If you're out there and you're the person who asked that question, and you still have more questions, please feel free to respond again. But it's sort of that release function, that release of tension.
Yeah, that makes a lot of sense. Thanks for explaining that. We do have some comments coming in from some of our viewers. The Malden Collective on YouTube said that was fantastic, all caps, exclamation marks. Thank you so much for brightening my day. We have some comments on Facebook coming in saying, thank you, Dawn and Dr. McQueen, great info, loved it, loved your presentation today. And I just wanted to close out by saying, I think one sort of takeaway for all of this, we've had a lot of videos, a lot of physicians talking about ways that people can stay healthy and safe during the pandemic. And one of the big takeaways, I think, from you today, Dr. McQueen, is by actually just explicitly adding humor to our lives right now as a way to help us get through the pandemic. So right along with washing our hands and social distancing, put on some comedy shows on Netflix, or finds one of our viewers, Carol, said that she finds that, perusing Facebook and all the funny videos and memes just makes her feel so much better during this time. And so we can start adding that to our list of things to do to take care of our health right now. And I think that's a really, really great message. And so I just want to thank you so much, Dr. McQueen, for being with us today. And thank you for all of our audience viewers on Facebook and YouTube. Thank you for participating and voting and being here today. We have a whole list of shows coming up that we have scheduled, other live events. Starting next week, we have on Tuesday, Quarantined, which is a group of local teens from Central Oregon talking about all things COVID and how they're getting through the pandemic. And we have the rest of our live events on Facebook, so you can see it there. And as always, you can view all of our videos either on Facebook or YouTube. So again, thank you for joining us today, and we hope you have a lovely weekend.